Tag, you're it. Medical and Health's Role in Emergency Response. Episode 4, Spreading the News, Disaster Communications.
On November 8th of 2018, the Camp Fire broke out. There was a huge public health crisis because of the Camp Fire.
We're very fortunate in our health department to have an excellent communications manager. She worked with the county and the EOC, but also worked with our DOC for some messaging that needed to go out. There's all sorts of information that needs to be shared. You're trying to make sure that your messaging is in coinciding with other community messaging, the news. And we were just very, very fortunate to have Lisa Almaguer as our communication manager to handle that for the health department.
Yeah, so communication is, as you might expect, complex and ever-changing in those situations. So the most important communication is that to our residents, the people living in the area.
Every after-action report, or if you're debriefing on a disaster, people always say communication, communication, communication. It may be a strength, but there's always areas to improve there.
Incident command standards require that a Public Information Officer, PIO, be assigned to the Operations Center Command Section. This role is considered essential when managing disaster and/or emergency situations.
What makes an effective PIO is communicating frequently and consistently, especially when there's an emergency. People need to know when they're going to get their next update. Even if you don't have a lot of information to share, you let them know at this time, we only know so much, but these are the things that we're doing. So when we come back at 6 o'clock, we'll have more information for you.
If there's a situation arising or brewing, oftentimes our comms folks reach out to the local PIOs or public information officers to coordinate messaging. A lot of times we'll set the framework, or we'll set the bar, or write the guidance and present it in a way and deliver it to our local jurisdictions, and they can then further disseminate it to their communities.
One of the big goals of doing what we do, responding to these incidents, mitigating them, dealing with them, is making sure that we're always communicating updates.
Sometimes it's appropriate where a local jurisdiction might take the lead in the messaging and want the, drafting the messaging, but sometimes it might be appropriate for the state to help either be the lead on that messaging or support or go from there. But it's always a coordinated effort.
In public health, we have a lot of messages that we craft and release to the public. Sometimes it's information that is, our annual messaging, and sometimes it's information about something that's happened that was unexpected or maybe happens only once in a while. For example, I'll use the Camp Fire. When areas that were destroyed by the fire were reopened or repopulated, there was a concern for people going back and visiting destroyed property, concern for their health and safety. So we worked together with CAL FIRE and our health officer and with the EPA, and we put together various topics and information about what people should be looking out for. Once it's approved, we then start that process of disseminating to the public. So the first way we disseminate information like that was in a press conference. Then we issued a press release. Then we posted on social media. But most importantly, we printed this material and it was handed to people as they were in line at the re-entry checkpoints for going back into properties.
The Public Information Officers, PIO, and senior-level staff must work closely with news media organizations during disasters and emergency situations.
Communication is always the first thing that falls apart in a response. And we struggle with this because in our county and in a lot of counties, the media is not in our county. So whatever communication method works in your county, that's what you need to use.
Most of the time you are working with your local media. Something that's very important to remember is they may request the interview from you, but the reality is it's your interview. You have control over the information that you provide and the answers that you give. And the other side of that is, with the inexperience of the reporters, they don't always ask the question that they should ask. And so it's your job to answer the question that they didn't ask that you wanted them to ask. In this case, you do a lot of pivoting, and you say, that's a really interesting question, but what would be better for people to understand is X, Y, and Z.
You need to develop relationships with media. I could call up the person who did the 5 or 6 o'clock news every night and say, can you get me on for 30 seconds or 5 minutes tonight to talk about something? Yeah, sure, come on in.
Risk communication plans should be reviewed and updated if necessary to include the use of social media in addition to the more traditional means and modes of communication.
Communication is always tricky, and I think we need to adapt the way we communicate. I always think of we're the state of California. We should be able to communicate like Coca-Cola. We should be able to really be marketing and proactive and have our risk communication messages in such a way that, we're building trust, we have the right messengers, we, are responding to the information out there on social media, some of the things that we haven't had to do in the past. And so how do we really change the way we look at communications and our role?
Social media is a whole different world, but we need to learn how to use that, because I don't care what your age is, whether you're young or old, social media in the nursing home is just as prevalent as it is in the high school. And we need to learn how to use that to get the message out and be right, be credible, all of those kinds of things.
Interagency communications and data sharing are critically important when responding to local, regional, statewide, and national events.
You also have other communication demands. The California Department of Public Health Licensing and Certification and the State Department of Social Services asking for information.
The key to responding is to have all of those agencies able to readily and rapidly communicate. The big one and the most troublesome area was data. I'll not even punctuate it with data analysis, data receipt. It was just data, right? We couldn't get real-time data. We had to find ways through executive orders, through this, that, and the other, to be able to receive all of that data. So we now have hospitals providing more real-time data. We have, data and healthcare information exchanges that are more efficient. The biggest problem really is that people don't want to share their data. As important as it is to share that data daily for us, the state, to respond to locals or regionals, we've got to be able to see that data coming our way.
I think there also have been improvements in electronic infrastructure and data management. Don't get me wrong, I think we still have a long ways to go, particularly data management and sharing of data. But there are a lot of tools that are in place now that weren't here 10, 15 years ago that allow us to communicate more efficiently, allow us to share information more efficiently.
Probably within the last 10 years is where I've noticed the most amount of change. Significantly better communication, significantly better cooperation, coordination, understanding that we all play a role in these type of incidents.